Alright, the other big story, India is the worst country for newborn babies. This is what Save the Children's State of the World's Mother report says. On their first day after birth, babies are at the greatest risk in India than any other country in the world. India accounts for almost 29% of first-day baby deaths globally. The statistics is worse than India's neighbors, Bangladesh and Pakistan. The report compares first-day death rates for 186 countries. And Dr. Rajiv Tandon, Senior Health Advisor for Save the Children, now joins us for more on this. So thank you very much for talking to us. These are disheartening figures, really. Can you tell us why this is happening? Why does India have this rate, the highest first-day deaths of infants?
The most logical cause for this is that we have a very large number of babies being born every year. In India, we have about 26 million babies that get born every year. And so that leads to a large number of babies that we lose also. What this report has tried to highlight is that the first 24 hours for the newborn baby and the mother are both a very important period where mortality or deaths happen, but at the same time they are also the time when a lot can be done to prevent these deaths. What we've tried to highlight is that we need to know, first of all, where are these babies being born, because in spite of Government of India's initiatives that has increased in very, very large numbers the babies that are being born in institutions, they still remain to be some who deliver at home. So what is needed is we need trained, motivated, well-equipped frontline workers to be able to deliver what is needed both to the mother and the newborn babies. This has to happen at practically every point. There is something called the continuum of care approach, where this situation should be there at homes, in the referral systems, in the facilities, both in rural areas, in urban areas, in the rich and for the poor, in tribal areas, in insurgent areas, for migrants. It also needs to happen for babies who are born boys and also for babies who are born girls.
Right. So, but where do you think the government is lacking in all of this? You've pointed out some of the measures that need to be taken. Could you just highlight some of the lacunae as far as the government and authorities are concerned?
I wouldn't really say the government is lacking at this point of time. For the last 1 year, we are seeing a lot of proactive leadership, specifically for newborn. We are also seeing leadership focus on what is called the RMNCH+A approach, where an entire life course approach is being looked at, where reproductive health, maternal health, newborn health, child health and adolescent is being focused. More resources are being put in, but the challenge is that not every state in India is at its same level. We still have some states, very large states, which are contributing to huge numbers of newborns which are still dying. Madhya Pradesh, Uttar Pradesh, Odisha, Rajasthan, and here you have districts which are also not the same across the state, and in the districts you have blocks again which are different and need different course of action which is contextualized. So I would not say that the government is totally lacking, but the challenges are paramount. There are challenges at the policy level. There are things that are needed to be done apart from just trainings of those frontline workers, also in the policies where some cost-effective, easy to deliver interventions can be made available to all the newborns.
Right, sir, and how closely do you think this issue is linked with the food security? The government is trying to push the bill in Parliament. How far is this linked to to malnutrition and the problem of overall food security?
Well, we know that practically 33% of all mortality related activities are due to issues of malnutrition. So there is a direct link. But we also know that it's not only food that leads to nutrition security, but definitely food is such a major contributor. So we welcome the food security bill, we welcome the movement on it, but we also want that in this we should have actually nutrition security, and through nutrition security, improved health overall of mothers, of newborns, of children, of adolescent girls. We also need actual improvement of some social and cultural norms. A lot of our girls get married too early. A lot of them have a baby too early. There are some issues which are social and cultural where we lead to practices and beliefs of situations which lead to newborn deaths. All of them have to be handled and improved.
Right, sir. Thank you very much for joining us. And as I do have figures from last year, and of course, it is a significant improvement. It's down from 46% to 29%. So we are on the right track, but a lot more has to be done. Thank you very much for talking to us.